session. So we will try to understand first what actually happens in this visual pathway, or what are the amblyogenic factors that are affecting the visual pathway in amblyopia patient, and what are the expected outcome with the newer technologies like binocular vision approach. So the eye, which gets a better stimulus, starts getting better and better inputs into the visual cortex, and the expansion of that visual area or the visual cortical area happens, and that leads to suppression of the amblyopic eye. So whenever you think binocular problem, then the treatment needs to be binocular in nature. So you should target to use both the eyes together. Let's see how we can achieve that. So there are very simple clinical environment you can create on your own to experiment. So this is one of the best technique I would rather always talk and then describe. Now there are technologies, so we got this different concept evolved, and we observed what could be improvised and looked at different aspect. So we got this dioptic based binocular activities, which are completely binocular in nature. Here we're not reducing the dominant eye resolution acuity. So we are always working with a similar kind of resolution acuity in the dominant eye and non-dominant eye, and introducing the visual concept by adjusting the contrast. So let's see what actually happens in the contrast adjustment. So just to brief you, when you have a patient with amblyopia and suppression, so the dominant eye would boss over the non-dominant eye, and as you see, the brain perceive only one image. But the moment you reduce the contrast, brain starts seeing both the images together, and that explains that by changing the contrast, the ocular dominance column can actually start perceiving both the images together. So that is one of the unique feature of adjusting contrast and seeing it. So in this case, as you see, that we have not looked at the decreasing the resolution acuity. Only by adjusting the contrast, you are gaining the binocular activities, and based on that, there are multiple games which can take care of the resolution acuity, patient's frequency to the target, crowding effect, binocular vision, like developing the fusion and stereopsis. So all those components are taken care of. So in an activity where you are trying to take care of patient's resolution acuity, or like anti-suppression activity, or developing the binocular vision like fusion and stereopsis, all are embedded into one system. And it is programmatic in such a way that based on patient visual improvement or improvement with the different visual function, the treatment would, or the activity will change its parameter on its own. So we have recent publication out of 161 patients. This was just a couple of weeks back. And again, we saw around 4 logMAR lines improvement happening over just 6 weeks time. So 6 weeks as in like in a patient whom we are treating for years and years, if you enroll for binocular treatment, actually you can get improvement much superior than any kind of penalization only in 6 weeks time. And not only the visual acuity, the amount of binocular vision they improve. So if you look at the left side bar, it started a patient who are like overall 65% patient or 66% patient do not have like stereopsis to start with. It was absent, but at the end of the program, 90% actually developed it. So only 10% still left by end of 6 weeks. However, all these patients were extended session. So we extend the session for another 4 to 6 weeks for the completion. And we do see that more than 95% of the patient do develop the stereopsis. So that is the biggest advantage of going for any kind of a binocular approach, not a partial one, a complete binocular approach. So there are classical cases to discuss today. So this is again, last time also I discussed at Gurgaon branch, but this is very classical. Routine OPD, we see a lot of patients coming with this kind of scenario. So they must have got for a job or something, they went and they realized that, okay, one of the eyes is severely amblyopic and suppressed, and they are expecting by doing any kind of refractive surgery will take care of their vision. It is very common question. If I do my LASIK or if I implant a lens inside my eye, my visual acuity is going to improve, right, doctor? Or right, optometrist? Or right, am I right? But the answer we give in a different way, that whatever you do, your visual acuity going to remain same. Now, as a patient, I would rather not go for any treatment because I want my visual acuity back, because I am looking for some kind of job, or I am not getting my driving license, especially in Western countries or Middle East, where the visual acuity parameters are mandatory. Even in some Asian countries, or even in Australia, Singapore, there the visual criteria is very important. So with this kind of visual acuity, I'm not going to get my driving license, and I need a solution. So as of now, if you look for only a monocular approach, there is no solution for them. However, if you look at a binocular angle and enroll for a program like Bynocs or similar to that, you can get very good improvement. So now this patient agrees for any kind of refractive surgery you suggest. They can go for a specialist contact lens, or they can go for implantable Collamer lens, or even they can opt for other phakic implants, or some doctors may look for LASIK procedure if the corneal thickness are optimal in nature, even in this high refractive error. So a classical case like this can be handled and managed in the best way with the binocular approach like Bynocs treatment. Next case could be another classical example. So patient underwent multifocal IOL implant at, as we know that at 65, most of the patient now, and there is a demand for multifocal IOLs, but after IOL implant, we realize that patient visual acuity is suboptimal in one eye and very unhappy. And what the patient would blame at the first point of time, that something is wrong with my surgical or IOL calculation. So the blame goes to either on the biometry or in the doctor's surgical skills. However, as a clinical perspective, with a plano diffraction, we know that this is the best possible biometry can be done and the surgical intervention can be done. Then if you dig into more and you realize, okay, patient was hyperopic in nature in that eye, and there was anisometropic amblyopia since childhood, and patient never disclosed prior cataract surgery, because over a period of time, patient visual acuity decreased in both eyes and never realized, okay, I should have mentioned before opting for a premium IOL like multifocal IOL. Now, what is the solution? Now, if you look at any Western countries, they would rather go for IOL explantation. We have classically, this case was posted for IOL explantation in that eye because patient was not getting used to. So this patient was enrolled for Bynocs, and we could improve the visual acuity to 6/7.5 only in 6 weeks, and the amount of binocular vision they gained was enormous. So patient become good, and visual comfort was very good, started reading from both the eyes together. The multifocality effect were best because patient could see from both the eyes together. So this was another classical example where a quick screening for amblyogenic factors can guide you a better treatment approach even at the age of 65 post IOL implant. Now, as we saw over a dichoptic training, what all things can be achieved. So whatever approach you go beyond the traditional monocular approach, in a binocular way, if you look at in a dichoptic, the compliance become good because somehow it is gamified in nature. So whether you look at the Tetris game, so something is to play with, or a similar game, jump and fly in the store, so it becomes more engaging, and with other gaming activities or watching content on Cartoon Network, or maybe with a Cure site, or even a program like Bynocs, where there are different activities are there. So wherever there is a component of gamification, so the adherence, the compliance level becomes better, and patients start enjoying it, playing it, and that results in a better outcome of the program. The improvement of the visual acuity is quite fast. You can achieve 3 to 6 log multi-line visual acuity improvement only in 6 weeks time. If there are more amblyogenic factors or a denser amblyopia, you can extend it at any point of time. And most of the dichoptic training can restore patients' binocular visual functions like fusion and stereopsis, and it is effective in older age group. And the last but not the least, it do not give you recurrence. What is very important, that once you achieve the treatment, it should stay there, it should be sustainable, and it should maintain the visual acuity and binocular vision that it gains, and which is very evident with the dichoptic approach. Now, whenever you look for this dichoptic approach, there are certain inclusion or the criteria, what would say you need to look at, that there are certain patients may not suit for this program. And for those are, first and foremost, do not enroll a patient who has manifest deviation. So if somebody has manifest deviation, that needs to be corrected prior Bynocs or any kind of binocular enrollment. The reason being, when you have a deviated eye and you are like giving a binocular approach, so you are going to stimulate a non-foveal point into the deviated eye. So better not to give binocular approach before correcting the strabismus. Very, very crucial point. Now, if somebody having microstrabismus, still it is very difficult to manage. The prognosis is guarded. And if somebody already developed eccentric fixation, then the prognosis is very poor. As we know, as we go away from the foveal centralis, the density of the cone and the size of the cones become lesser and lesser. And as we have lesser density, we'll have more crowding effect. As we have lesser size of cones, we'll have more issues with the resolution acuity. So the differentiation ability between 2 points will be more difficult, and that leads to a resolution acuity deficit. So with this context, we know that what are the boon for dichoptic approach and what we need to really keep in mind before enrolling into any binocular or a dichoptic approach treatment. And if you are rightly into the assessment and managing the patient, you could get very good results with these newer modalities of amblyopia treatment. And we look, this is, or we see the future in management of amblyopia lies in binocular approach. And there is a huge paradigm shift that is happening in recent years. Thank you for your attention, and I would love to interact and answer queries that you have now.